So for anyone who does not know me, who is not an SAJer, I want to introduce myself first. I'm Lauren Grable Herman, the rabbi of SAJ. We are extraordinarily fortunate to have 3 members of our community who are really on the front lines of COVID, not only in terms of treatment, but treatment of patients, but in terms of this vaccine that is giving us a lot of hope and possibility as we enter into what we hope will be a better time from here after such a difficult year. So we are thrilled to have them. I don't want to waste too much time, but I want to just invite you can either do a gallery view or spotlight view. You can see the speakers a little more easily, or you can see everyone, up to you. And just to keep yourself muted, we're going to have a presentation from these 3 doctors first, and then there'll be time for Q&A, and the questions can come to me in the chat. So if you have questions, you can put them in the chat private directly to me, Rabbi Lauren, and I will keep track of them. But let's wait until we've heard some of the presentation before the questions come in to make sure your questions aren't answered first. So without further ado, I'm going to invite Dr. Melissa Stockwell to share her screen so we can introduce all of you properly and then get going on the content of this program. So just a teeny bit, there's much more to say, but a teeny bit about our speakers tonight. We have, we have Dr. Marina Catallozzi, who is the Associate Professor of Peds and Population and Family Health Director, General Health Public Health Program in Columbia University. I'm going to say, because it's an SAJ program, we're going to use your first names, but we do respect your titles. Marina is a practicing pediatrician, and she is the faculty co-chair of the Columbia COVID-19 Student Service Corps, a service learning organization of students and faculty at Columbia responding to the needs of the hospital system and community arising from the pandemic. CSSC, this program is going to be part of the CUIMC NYP Armory mass vaccination. And then we have also with us Dr. Robert Grossberg, Associate Professor, Department of Medicine, Infectious Diseases in Montefiore. And Rob is also an investigator on the AstraZeneca COVID vaccine trial, in addition to his role as an investigator on treatment studies for COVID. And finally, Dr. Melissa Stockwell, Associate Professor of Peds and Population and Family Health. They work together, co-chair Columbia University Irving Medical Center COVID-19 Vaccine Committee. As we saw, Dr. Stockwell, Melissa, is a co-chair of the CUIMC COVID-19 Vaccine Committee, is involved in the vaccination rollout by NewYork-Presbyerian Hospital. She also co-leads the CDC's Clinical Immunization Safety Assessment Site at Columbia University, which consults on vaccine safety questions from across the US. All 3 of these incredible doctors and human beings, so I have the privilege to know, are members of our SAJ community, and they have offered their wisdom and expertise to share with us this evening. So from here on, I'm going to invite the doctors to share some words with us and some teaching, and then we'll have a time for Q&A.
Wonderful. I'm going to get us started. I'm Marina, and in full disclosure, Rob is sitting right next to me because he's my husband, and Melissa and I work very closely together, and she is my division chief, actually. But most importantly, I just want to say that it is a privilege for us, I know I speak for all of us, the connection to SAJ and the support that everyone really gave to us, particularly in the spring when things were so difficult at the beginning of this pandemic, were really so soul nurturing for us. And we are happy and privileged to give any information that can be helpful in putting an end to this pandemic and keeping our community healthy. So thank you all for all of your prayers and good wishes and frequent texts from Rabbi Lauren especially, but also thank you for this community to help sustain our children and our families during this time. We're just going to go through some really quick slides just to get lay of the land, make sure we all have the basics together, and then we want to leave a lot of time for questions. So just really quickly, the pandemic globally, we know there are 96 million, over 96, I'm sorry, 93 over 93 million confirmed cases with over 2 million reported deaths. And unfortunately, the confirmed cases in the United States have been more than 23 million with nearly 400,000 now reported deaths. In New York State, we were hit very hard at the beginning of the pandemic and have had over 1.2 million cases, total cases for positive tests, and 40,000 reported deaths in the state. And then in the city, 26,000 of those deaths. So I know many of us have had unfortunate proximity to those and know how critically important it is to stave off the continuation of this pandemic. We wanted to talk a little bit about, you guys have all heard about herd immunity. I like to call it community immunity because it helps us to recognize our place in it as opposed to a herd. But this illustration can be very helpful to look at, if you have sort of a group of people, let's say, who are generally healthy in blue and not immunized. The yellow represents our immunized healthy folks, and the red, the not immunized sick and contagious folks. And what we know with a very contagious disease like COVID, particularly when masking isn't happening, or even when it is, which is some of the cases that we're seeing now because of the contagiousness, that if folks are not vaccinated or don't already have immunity because they've been recently ill, that most people will get the disease and will get infected. If you have, in a case like COVID, where it is very contagious, if there's masking happening and there's some people immunized, but you have a couple of people who are sick and contagious, again, most of the population is still going to be sick. You have to have a very large percentage of the population with antibody response or with vaccination to be able to really make a difference in terms of incidence of new cases. And so, I've heard lots of different reports about like exactly how many people do you need, but what we know is that we're not there yet and we need to get there fairly quickly. What we have seen over the past year is this really unprecedented, coordinated global effort. But some of that, I think there's a lot of fear around kind of how could this have happened so quickly, but this mRNA vaccine technology has been in development for over 30 years. And without all of the science that has already happened with mRNA vaccines, we wouldn't have been able to get here so quickly. And part of that is because of the initial SARS pandemic that happened in China and in Canada in 2003, and then the MERS pandemic or in 2012. And the idea was that targeting, if you remember, if you look at COVID and you always see the little red spikes coming out, it's really targeting that spike protein. And because of the emergency, really, you can see how quick the timeline was, but it really was rooted already in very solid science. And I think that's something that is, for me, been very reassuring that these studies had already been happening and so much work had already happened. And as a pediatrician who thinks a lot about vaccines, and particularly working with Melissa, who so much of the work that she does, sort of knowing about those efforts already was really important. So just to think about how a vaccine works, this is a really good way to think about it, is that you're basically showing your immune system what a piece, in this case, I don't know if you can see my pointer, but these are the spike proteins, what a piece of the coronavirus looks like. And it's like a mugshot. It's sort of saying like, look, if you see this again, like go on attack mode, put up all your armor that you can. I often, in explaining it to families, will say, it's sort of like making sure that your sort of your posse, your family, whatever it is, your army is ready to kind of come out and attack if you actually see the real virus, as opposed to this mugshot that you'd seen before or this little snippet that you had seen before. And I think I'm going to hand it over to Rob now to talk more about the mRNA vaccinations.
Okay. So getting further into the weeds here a little bit, just to get further into the technology behind the vaccines that are currently available. So the Pfizer-BioNTech vaccine and the Moderna vaccine are both messenger RNA vaccines, mRNA vaccines, and the way they work is mRNA is is a piece of genetic material, nucleic acid material, that the cells in our body use to make proteins. So a piece of the RNA from the virus is taken. It's actually a piece of the spike protein gene that's so important for the immune system to recognize. And it's put, so this piece of RNA is put into this lipid particle, this fat particle. And then it's put together with just literally 2 or 3 other ingredients in the vaccine. And when it's injected into a human, our cells absorb these fat globules and the mRNA in it, and then we make this piece of the spike protein so that our immune system can recognize it. So at the bottom, you can see these antibodies on the bottom right are there being produced to recognize the spike protein, and that is like the mugshot for our bodies recognizing when the actual virus might invade. Okay. So mRNA vaccines, like Marina mentioned, it's new technology, sort of. These are the first licensed vaccines to use this technology, although there have been vaccines developed for this for other viruses like the SARS virus and the MERS virus and some other things. So it's not entirely a new technology, but these are the first to make it on a mass scale. And there are theoretical benefits and likely true benefits of this technology. One, it's completely non-infectious. So there's no viral material entering our body when we get this vaccine. It's just a piece of nucleic acid. It's totally non-infectious. It can't be incorporated into our own genetic material. It can't infect us. And our body makes mRNA all the time and disposes of it. So it's naturally degradable. We degrade the mRNA that is injected with the vaccine, just like we degrade mRNA that we produce for other reasons. They're stable, so they don't degrade over time, provided that they're stored properly, and we can talk about that. And also, because the vaccine is just this piece of nucleic acid, you tend not to develop an immune response to the other parts of the vaccine. Some vaccines are put into other non-infectious viruses, or there are pieces of other viruses there, and you can actually develop an immune response to other parts of the vaccine, not the part you want to develop the immune response to. So those are some of the reasons why this is very appealing. So I think you've all seen this. These are the 2 available COVID-19 vaccines. They're very similar. They're produced by 2 different companies. And the way they were tested was different. So they have slightly different, they're sort of prescribed in slightly different ways. Both are extremely effective, over 90% effective at preventing symptomatic disease. So they're both 2 doses. The Pfizer one is 21 days apart. It's licensed down to age 16. The Moderna one is 4 weeks apart, licensed down to age 18. They've both been tested in tens of thousands of patients, and both are very effective. We can go on, I think. So like I said, tens of thousands of adults from diverse backgrounds, including older people, communities of color, have participated in clinical trials of these vaccines. And even though the timeline was quick, there were no shortcuts. These vaccines went through the same safety standards as other vaccines. So no steps were skipped. The timeline was just compressed so that some stages overlapped. For example, instead of waiting until all the testing was done to start making the vaccine, the companies were encouraged to start making the vaccine once there was an indication that they might work, so that we would have a supply to start vaccinating people right away.
I will take over from here.
Okay.
So what are some of the things that, some side effects you might experience after being vaccinated? So first of all, some people have a reaction to the vaccine, others don't. For those who do, those symptoms are part of a normal process of building immunity. And if you don't have a reaction, that's also completely fine. So you don't need to be concerned either way. For both of these vaccines, which again, as Rob said, are very similar, the most common reaction is soreness at the injection site. And the next most common would be fatigue, headache, muscle and joint aches, and fever and chills are a little bit less common, but can happen. And I would say from my experience, when I was vaccinated, definitely sore arm, a little headache the next day after the first dose. Reactions are more common with the second dose. Those reactions aren't different, they're just more common. So maybe a little more common to have, again, soreness, fatigue, headache, and fever, but again, not different. For most people, those side effects really just last a day or two. They can be relieved by taking Tylenol or NSAIDs. Again, if your doctor told you can take those, or if some people have conditions where they're told not to take those, in that case, obviously you wouldn't want to take them. We don't suggest that people pre-medicate. So what I mean by that is not to take Tylenol or Advil before you get vaccinated. There's a theoretical risk that could potentially affect their immune response. So don't take anything before you get vaccinated, but afterwards, if you have any of these symptoms, it's completely fine. And then with any medicine, allergies can be seen. And this is still rare even with the COVID vaccine. So what is reactogenicity? What do we talk about? And basically, as I mentioned, it's just your body generating our immune response to the vaccine target. And so those are normal, right? So sometimes it can be just from being injected, you can have that local pain or swelling. Sometimes you can have systemic symptoms like headache, fever, or fatigue. And that's all okay, nothing to be concerned about. And though we do talk a lot about these potential side effects the next day or two after the Moderna or Pfizer vaccine, I actually love this slide, which actually Rob and Marina shared with me, and I'm going to use it now to all of my talks because many of you may have gotten the Shingrix vaccine, which is the shingles vaccine. And you can see that actually the side effects are pretty similar, right? Like pain at the injection site, actually much more redness than the Pfizer and Moderna, maybe some swelling, body aches, fatigue, headache, chills, fever, in fact, a lot more fever. So all of the kind of very similar to usual vaccine side effects that we see. And again, nothing to be concerned about. So you hear a lot about the rollout process and phases of vaccination. So just to remind you, phase 1A was the first phase. That was healthcare workers and long-term care facility residents, plus a couple of other groups. We're now in phase 1B, sorry, that includes teachers and education workers, first responders, public safety workers, public transit workers, people age 65 and older. And they are adding the immunocompromised people, but the New York State is still talking with CDC how to define that. So again, Governor Cuomo mentioned that at the beginning of last week that they will be adding that group, but has not yet been defined. So stay tuned. So how do you get vaccinated if you want to get vaccinated? So at some point it will probably end up in primary care offices. Right now it's not. It's really mostly in large hospital systems, and then in federally qualified FQHCs. And then some of these systems have a lot of outpatient kind of outposts where you can get vaccinated. So around New York City, you can go to this Vaccine Finder website and you can click. So all the Montefiore sites are related to where Rob works. Those are all on the Vaccine Finder, or most of them on the Vaccine Finder. So you can go and see who has availability. NewYork-Presbyerian Hospital, where Marina and I work, has a different website called Vaccine Together NY, and there's a place to check availability. And then you can actually, you have to sign up for an account called a Connect account, which is our hospital record, and then you can get an appointment. So for our hospital, you have to be 65 and older and a New York State resident. That was based on the vaccine that was given to us. But for the general Vaccine Finder NYC, including the Montefiore sites, you can, as long as you're in 1A and 1B, and you can see the eligibility when you sign up. There's also New York State sites. So if you're not in New York City right now, there is a site for New York State where you can click and you can look to see where you can be vaccinated. They do want to make sure you're eligible. So when you sign up, there is an eligibility checklist, and at all of these sites, when you go, they have you attest again to your eligibility, because they want to make sure that people really are within one of that 1A, 1B eligibility. So we thought that we would kind of go over some of the common myths about the vaccine, and then we'll open it up to questions. So maybe I'll read it and I'll read it out to people. One thing that we often hear is, I've already been infected with COVID-19, so that means I don't have to be vaccinated. So Rob, you want to take that one?
Sure. So it's recommended that people infected with who have had COVID still be vaccinated, and it's recommended that you get vaccinated at any point after you've fully recovered. So that could vary from a week or two or months, but you should be fully recovered. And the reason to get vaccinated is, well, there are a number of them. The main reason is that we don't know how long immunity from COVID will last. We think it lasts in most people at least 3 to 6 months, but it probably doesn't last much more than that in many people, because we know experience from other coronaviruses, antibodies wane over time and people become susceptible to coronaviruses after a period of time. So it's still recommended that people get vaccinated even if they've had COVID-19.
So the next one is, which I guess you already kind of covered, which is the vaccine contains a live virus, so it can give me COVID. So you already covered that. So Rob, I shouldn't get vaccinated because there's new strains that I've been hearing and reading about. So isn't it better not to get vaccinated now?
Okay, so that's a hot topic at the moment, because every day there's a new 3-letter strain popping up in somewhere. So what do we know about the new strains? So from what we know, most of the new strains appear to be covered by the current vaccine. One of the reasons we're finding all these new strains now is, well, there's 2 reasons. One, people are looking for them more. And 2, we know this is sort of the natural evolution of viruses, especially RNA viruses like coronaviruses and influenza. They evolve over time, they mutate. And many of these mutations are not going to lead to any reduction in the efficacy of the vaccine. It is possible that some strains might not be as covered by the vaccine, but we don't know that yet. But the time to get vaccinated, I would say, is as soon as possible.
Hold on, I made a mistake there. Marina, we've heard the myth that the vaccine alters my DNA.
So hopefully, as Rob discussed before, again, it does not get incorporated into your DNA or change anything about you or your genetic code or system. It really is just, again, showing your body this mugshot, getting antibodies to respond, so that when you get exposed to the actual virus, those antibodies will then come out in force so that you don't get the infection.
Marina, so what about once I'm vaccinated, I no longer need a mask and I don't have to practice social distancing?
So this is, I think this is what we all wish were true, right? That there were some magic bullet right now that we could just sort of say like, okay, let's go back in time. What we know right now is that, again, sort of going back to that community immunity slide, we need vaccination, and we need to continue masking and practicing social distancing, because it's going to take a very long time for 85% of people, for example, to have vaccines so that we can really be protective of everyone. So masking and social distancing are absolutely still first line right now in my mind. Melissa and Rob, I'll defer to you if you think differently.
No, absolutely. I'll take the next one, which is I can't get the vaccine because I have allergies to food, so eggs, shellfish, or medications or bee stings. So I'm actually going to spend a little bit of time just explaining this one, because I think it's one of the most common questions that we get. So allergies to foods and venom are completely fine. If you've had anaphylaxis to them, then likely wherever you get vaccinated, so a severe allergy, they'll have you wait 30 minutes after the vaccine rather than 15 minutes after the vaccine. But again, it's perfectly fine to get vaccinated. Allergies to medications are also, so to general antibiotics, another thing we hear, so penicillin, sulfa, et cetera, also completely fine. If it's been that severe anaphylactic reaction, again, they'll have you wait 30 minutes. You probably have heard about something called PEG, so polyethylene glycol and polysorbate. And that's because those are things that are in the vaccine. So as Rob said, the vaccine is actually a very, very simple vaccine. As Marina's in my chair likes to say, there are really only 4 things in it. There's basically salt, sugar, protein, which is the mRNA, and then this kind of fat or lipid envelope that helps it get into the cell. And that includes something called PEG to kind of help stabilize everything. And it is not a common allergy, but we think that might be for people who do have a severe allergy to the vaccine. It might be because of a PEG allergy. So if you have a history of mostly anaphylaxis to an injectable medicine, and you have an allergist, you can call your allergist and they can look up, they can tell you if what you're allergic to has PEG in it or polysorbate. If it does, you've had an anaphylactic reaction, then we would not recommend that you get either the COVID-19 vaccines, and you can wait for one of the other vaccines that come down the line, the AstraZeneca or the Johnson or Janssen vaccines. But again, there's only very, very, very few cases where someone can't get the vaccine, and that's because they have a severe allergy to PEG or polysorbate. The COVID vaccine causes severe side effects. Rob, do you want to take that one? Or do you want me to take it?
Sure, I can take it.
You can take it.
Yeah. Oh, let me unmute myself.
We hear you on Marina's.
Okay. Yeah, so I can take it. So no, it doesn't, is the bottom line. Many people have a sore arm. Some people have some fever and achiness for 24 hours or less. And in terms of severe side effects, those have not been seen in any measurable way. And the anaphylaxis issue, I think the rate is estimated at 11 per million vaccinations. So it's extremely uncommon.
Absolutely. So I'll take the last one, which is the vaccine can cause infertility or miscarriage. So there's been a lot of misperceptions, a lot of things going on social media, both affecting both male and female infertility. It is not true. In fact, if someone is planning to get pregnant, this is exactly the time to get vaccinated against COVID. We do know that when people are pregnant, they are at risk of having a more severe COVID. And so actually getting vaccinated against flu and against COVID before you get pregnant this season is actually probably one of the best things that you can do. And both Marina and I have heard many talks from our specialists, and I'm sure Rob has as well, specialists at Montefiore, about infertility and miscarriages. And again, the COVID-19 vaccine does not cause that. So I think we're going to move to the Q&A. So I guess Rabbi Lauren, I think you're going to do that for us.
First of all, thank you so much for bringing your expertise and all this information to the SAJ community. We're extremely grateful. And I wanted to also just acknowledge that Melissa is on the board and has been advising us around our B'nai Mitzvah policies and how we manage our own, when we need to be together and how we do that. So thank you also for that work with our community. Okay, a lot of questions have come in. I don't know, I'm just gonna sort of pick a few and we'll get to as many as we can. I'm going back up. There were some technical questions that came in. Is there a risk of a cytokine storm, which you're gonna have to explain, if you're exposed to the virus months after being vaccinated? And is the immunity shorter with an mRNA? And I guess, how long is the immunity? It seems like this was asked a few times. And can we get a traditional attenuated virus vaccine? So these are questions beyond my knowledge base. So I don't know if you want to respond to that. Anyone wants to take that?
Marina's looking at me.
Well, Rob can go with it for this one.
Okay. Okay. So is there a cytokine storm if you're exposed to the vaccine months after being vaccinated? So to explain the question a little bit further, so the question refers to cytokine storm, which is one way of describing what happens to people who develop severe COVID-19. So I guess real quickly, so the virus that causes COVID-19, so people get sick generally from two main things. One is the virus itself, and the other is the immune response or inflammatory response to the virus. And cytokine storm is a term that's used to describe this dysregulated or sort of out of control inflammatory response. Cytokines are inflammatory chemicals in our body that occur in response to infection and other things. And when they're out of control, like they are in people who get very sick from COVID, they can cause more damage than good. And that's been described as cytokine storm. So if you're giving someone, if you're having someone recognize the virus with a vaccine, and then they get the virus, is that going to trigger this hyperactive immune response, I think is the question. So that has not been seen. It's not seen in most or maybe any other viral infections that we vaccinate for. So this is a directed immune response against the spike protein. So it's sort of a kind of a directed, elegant response and doesn't generate this kind of dysregulated response. And then I think part of the question was also, is the immunity shorter with mRNA vaccines? So we don't know the answer to that for this particular mRNA vaccine because the trials of the vaccine have not gone on long enough. Patients who are in research studies for these vaccines will be followed for up to 2 years, most of the studies. So we will get information about how long antibodies last and immunity lasts, but we don't know. But one of the reasons for boosting is to try to, stimulate a longer immune response.
And one thing just to add to that, it was a very, very small study, but Moderna did look at a group of maybe 30 people. They looked at 4 months out, and they compared it to people who they took their blood of people who had been infected against COVID, and they actually saw a greater antibody response at 4 months out after being vaccinated than people at 4 months out after having had the disease. And in general, this does come up a lot of the time for Marina and I, just for general pediatric vaccinations. It is not better to get the disease, right? We know that COVID is, can be very, very severe and deadly. And we really can't predict who that's going to happen to, as Rob can probably tell you, having taken care of a lot of these patients in the hospital. So again, really the best and safest thing is to get vaccinated. And I guess for the attenuated virus vaccine, Rob, if you want to.
I don't think there are any being developed. So unless you want to make your own.
Right. The only other difference with the ones AstraZeneca and then the Johnson & Johnson are adenoviral vector vaccines, which means that they have a little piece of an adenovirus. And Rob can send this better because he's running one of the trials. That's basically the way that the vaccine gets into the cell. So it's different than the mRNA vaccines.
But it's not the attenuated coronavirus, right? It's yeah. I don't think there's anything using attenuated coronavirus. Oh, and permanent immunity. So do vaccines offer permanent immunity? So no, probably not. I'm not sure we need permanent immunity from this because we don't know how long it'll last in this way anyway. So the answer is no, but we may not need permanent immunity. Not much offers permanent immunity. Even a natural infection with this vaccine doesn't offer permanent immunity either. Unlike, say, well, chicken pox, measles, those things we think of as providing permanent immunity, they don't really either, but yeah, that's a deeper conversation.
Thank you. Okay, so I know a lot of people have tried to make appointments and have had them cancel and or are just struggling to get those appointments made. So can you talk a little bit about the supply issues and what people can expect in New York City in the next couple of weeks and months?
Yeah, this has been really hard. I think it's really hard on all of us too. There's just been a lot of miscommunication or unclear communication from the federal government about supplies. What I can say is that, New York State, as soon as they get it in, they're shipping it to the sites. And I know there have been a lot of people who potentially made appointments at other hospitals and had them canceled. I can say, and again, not to put a plug in for our hospital, but we have been, for our site, the NYP site, the Armory that Marina and I are involved in, we are really not trying to make appointments unless we know we have vaccines. So the struggle is our appointments are only a couple days out so that we know we have the vaccine, but that's harder for people because they can't necessarily plan. So this, kind of balance between having appointments available much in advance and then not knowing if you have the vaccine versus having it be more in real time. And all the hospital systems are trying to figure that out. I hope after tomorrow, we'll have I don't think it'll overnight be perfect, but I think hopefully we'll have a little bit more knowledge ahead of time of what's coming. And I know there's an article today that I read, I can't remember in which website, about this sort of really the need really across the country for everyone to be able to plan a little bit better and be able to know. So I do think it will get better, and I know it's really hard now and frustrating, and I'm sorry, I apologize on behalf of all the institutions for that, because I know it can be really tough.
So someone asked a specific question about, if vaccines become available at pharmacies, how do we know if it is okay to go there? So one person mentioned in particular a pharmacy, Anthrop and Joseph, but or two of those two different ones. How do we know if a pharmacy location is going to be, I don't know, the right thing to do, or is that okay?
Do you want to take the fear? I mean, to me, I would say I think it's fine. I mean, so I would say if you have severe allergies, then maybe you want to be at a place like at a healthcare center. But just for if you sort of have no history of any kind of reactions to anything. I actually got my flu vaccine at a pharmacy. My whole family did this year just because it was easier. And it was great. It was a Rite Aid near us. You sort of go and they kind of still have you get your vaccine and watch you. So I think for me, it's would be fine. I don't know if Rob or Marina have a.
No, I agree. I mean, that's not an option right now. I don't think in many places.
Yeah, there are. So a bunch of Rite Aids are going to start to have it.
Yeah, soon. I think when that happens, I think that's fine.
I would love to describe what the Armory site is like. I did vaccinations on Friday evening, and so pretty much every single New Yorker that I spoke to talked about how this was like, so New York, they had 5 family members, refreshing to get an appointment, which is what Rob and I did for Miriam Grossberg, who is on the call right now. So there's no in if you work at a hospital. It's everyone's unfortunately in the same situation. But I was really, I think, just to reassure everybody. So you get brought in, there's a trained vaccinator, there's translators if necessary. And if you've had any serious allergic reaction, there's a color that you get to be watched for 15 minutes and a sticker color that you get yellow for 15 minutes, pink for 30 minutes. We err on the side of watching people longer, just in case there's trained medical personnel who are available apart from the vaccinators if there is any side effects, and also you get your second appointment. I know there was a question here about second appointment. So we don't give the first if we can't tell you we're going to have the second, and it should be the same exact vaccination. So right now it is Pfizer, Moderna, and that's what is guaranteed. And so I have been actually really impressed by how that has rolled out at NYP. I think it will open up more everywhere in the next couple of weeks. So, can't say more than it is so hard to be patient right now. But truly keep masking, keep washing your hands, stay away from people until you can, get an appointment.
Yeah, and I would say we're opening about 2,000 appointments a day now. So again, I think there's been much more availability. And again, even though Marina and Rob and I are talking about allergies, they're still very, very uncommon. So we're kind of talking about the most significant thing that can happen. And just to reassure people that all these sites are completely set up for it. I was there today also, and everybody was totally fine. So again, it's not common. It's just that we're prepared for it in case it's necessary.
Great. So I think there's a couple questions related to the issue of what you can do after and how it changes your behavior or not. One person asked if it's safe to, how safe is it to fly after you've been vaccinated? Does it change the equation for people? Maybe how long do you have to wait for that? And just, again, with the I know we keep hearing that we need to continue wearing masks. And so just how do you perceive that this would change people's behavior once they've received the second dose of the vaccine, or could, or should, or not?
Well, we know that even after the first dose, after about 14 days, the likelihood of developing severe COVID-19 goes down a lot. But there are a lot of things we don't know. One thing is we don't know whether people who've been vaccinated can become infected and transmit the virus. Is it just that they're not getting sick, or is it that they're actually not getting infected? Because if it's just that they're not getting sick, then they still can infect others who are unvaccinated. And we also know there's a percentage of people that don't develop good response, and we don't know who those people are. It may be that elderly people have a less robust immune response and are less protected. We see that with other vaccines. So what we're really hoping for, like we started out with, like Marina described, is community immunity, where there's so many people who are vaccinated, the amount that can be transmitted and infect other people goes down to levels where it's no longer a threat. So until we achieve that, I would suggest not really changing your practices and keep wearing a mask. Don't travel unless you need to. Wash your hands, stay away from crowds. I don't think anything really is likely to change until we have that kind of sense of community immunity.
I mean, I think I'm inserting my own question here, but is there any projection for that community immunity? And also, I mean, we have in New York City, which I would imagine will be a higher number of vaccinations than, let's say, Georgia, right? So like, are we doing city immunity, national immunity? Like, what does that look like? Can you talk a little bit more about that? I mean, there's no way of knowing.
Yeah, there's no way to know.
Yeah,
it's a moving,
it's a moving target.
And I think just because I see some questions about, ethically as a psychotherapist who maybe is working remotely, should I get it? Yes, I think for a few reasons. One is you're going to be contributing to that community immunity. If you are allowed to get the vaccine, you should get the vaccine. And also what I have seen is that people who've gotten the vaccine who could be working remotely, also, for example, at this rollout at the Armory, those are people who are, maybe a little bit more comfortable coming in and helping to register others to get the vaccination. So there's so many ways that actually is ethical and responsible to get that vaccine. Even if you're not going in every day, you're part of that community immunity. So I think once you get the go ahead and you can, I know frustratingly get on these sites to get an appointment, you should feel comfortable getting the vaccine and knowing that you're contributing to that, that goal we're all going towards, which seems like a moving target, but we know is one that's more attainable the more people we can get this to.
And you mentioned something about this, I think, in the last response, but is there any way that we know that the vaccine has an adverse effect on people who have autoimmune deficiencies?
Rob, do you want to, or do you want me to take that one?
Yeah, no, we don't. There's no reason to think that these vaccines, the mRNA vaccines, would have any adverse effect on people with immunodeficiencies. Lots of those groups were excluded from the clinical trials, so there's not a lot of information about that. But from a scientific perspective, there's no reason to think that an mRNA vaccine would cause a problem for someone who's immunocompromised or someone with autoimmune problems. There's more of a concern that people who are immunocompromised or take medications that suppress the immune system might not produce antibodies. They might not produce the immune response. So it may not work. But I think it's safe to say for the most part, it's likely safe. But, as there's lots of individual circumstances, I would encourage anyone to consult their own healthcare provider.
Great.
That's my disclaimer.
Great. Seeing these questions, I'm trying to put them sort of together, but they're not all. So one question sort of went with something we spoke about, which is, given the supply issues, if we're worried about supply, should we wait in general because we're not clear that we can get the second dose if we can get the first, meaning should we bother getting a first if we're not sure we can get the second?
I would say get the first dose. If it's available to you, absolutely get the first dose. And again, we have a little bit more information for the Mrna vaccine, where they had more people who only got the first dose. They had a little bit longer time, a mean of 28 days. And for them, they actually think you get 80% of efficacy from the first dose. From the Pfizer vaccine, we don't have as much information because they only looked at people right up into the second dose at 21 days, and it was about 50% efficacy. Although in reality, it could be higher. But it's absolutely worth getting one dose. And again, they are still shipping the second dose, 3 weeks after the Pfizer and 4 weeks after the Mrna. And sites that are doing these max vaccinations are know what appointments are coming up for second doses and making sure that vaccine is available. And maybe you might have a couple of fewer first dose appointments if they're lower on vaccine. So absolutely worth doing it, and doing it now. I wouldn't wait for that. Great. It's also okay, even though we say 21 to 28 days, it's okay if it ends up being, if you were due right at 21 days and they said, you need to come in a couple of days later, like that's fine too. Again, that's the trial was based on the 21 and 28 day interval, and the idea is to get people protected as fast as possible. So usually we say it takes about 7 to 14 days after the second dose to have your full protection. So again, we want to get everyone vaccinated, get the second dose in as fast as we can, so that we really can contribute to the community immunity, which I think is going to be our catchword for this talk.
That's great. I love it. We had a couple questions from parents about camp safety, and I think it's actually worth doing a whole program on that if you guys are up for that another time, but maybe on the short end, for parents in particular. In the short end for now, do you have any quick thoughts about safety around sleepover camp and/or what kind of day camps would feel everyone's COVID protocols are different than the other, but kind of in a medical sense, what you think is advised?
Yeah, so Rob and I actually have both served as camp docs for Camp Havaya, which a lot of the kids from our community go to. And I think that, what we'll see probably in the next few weeks to months will be planning around that. There have not really been studies that have come out yet. They probably are coming out around the pediatric population. So it's really going to be more, has the staff been vaccinated? Will camp directors, et cetera, be able to be counted as teachers so that they can get vaccinated as well? I think that will have a lot to do with whether or not these camps can move forward. We did see some sleepaway camps with good testing protocols happen this year. Camp Havaya did not open. We were in agreement with them and spoke with them about that. And I think that there will need to be, testing available, and also there will need to be vaccination of like the staff who's there. I don't know if you have other comments.
Yeah, no, I agree. And it's it's not that long off, but it's a ways off. So a lot may change by then in terms of how comfortable people are that there's less of this circulating.
One question is, speaking of kids and camps, is there any plan to develop a vaccine for children, or is the plan simply to establish herd community immunity and not worry about the kids? Because right now I know it's only for adults.
So actually there are ongoing trials. So the Pfizer vaccine is actually licensed down to age 16, the Mrna is down to 18. Both of them have ongoing trials into like the kind of teens down to 13 and older. And actually Pfizer is starting a trial down to age 5, I believe. So they are very actively in both the groups looking at that. For those kinds of trials for the younger children, it's a different kind of trial. For the most part, we call them bridging studies. What it means is not necessarily that in that case that one child gets the vaccine and one doesn't and gets placebo. A lot of times they're doing different dosing. So to say, okay, maybe let's see what a half dose looks like and a full dose, or a quarter dose, half dose, full dose, and then look at the immune response, and then use that and the information that we know from the adult trials, look at the response in children and find the right dose for kids. So those kinds of trials sometimes can happen a little bit faster. I don't know, when we'll know. I don't know if Rob has any insight. I think that the Pfizer trial that's going down to age 5, I think is not happening quite yet. It's happening a little bit later into the spring. So, I'm hopeful. I think as pediatricians, Mrna and I are, very strong, support of having a vaccine for children, because, I don't think we're going to achieve herd immunity unless our children are protected. And there was definitely this incorrect perception over the summer that kids, and over the spring, which, all of us who took care of children were said was wrong, that kids were not getting COVID. That's not true. We know from the American Academy of Pediatrics that children do get COVID. Luckily, they're actually, for the most part, are all, doing, for the most part, have been doing fine, but they can infect other people in the family, and sometimes they can get severe disease themselves. So it's going to be really important that we do a vaccine for children as well.
Great. A couple technical questions. Do you have to be in the hospital system to get an appointment through that hospital website, or is it open to anyone? And someone who's at, NYU.
Sure. So yeah. So what I can say for us, you don't have to be a patient of NewYork-Presbyerian Hospital to get an appointment. You have to you sign up to their patient portal, but you don't have to be. You don't have to be a patient. So for our site specifically, again, if you're 65 and older, you have to be a New York State resident. Then you can sign up, and you don't need to be a patient. I think it's the same for the Montefiore ones also, right? Robert, do you know that are open for the New York City?
The Montefiore sites, I think you do need to be a Montefiore patient at this point. That's probably going to change in the next few days. And then all the sites on the city website,
Right. And they're right. So if you look on the New York City website, you can see all the sites that you don't need to be, or you can come to.
Yeah. I just also wanted to mention before I forget, there are options for people who aren't eligible in the current phase. So if you're not eligible and you really want a shot at getting the vaccine, I would encourage you to consider enrolling in a clinical trial. So if the AstraZeneca trial that I'm involved with is now closed to enrollment, but there are other clinical trials in New York that are open. And if you go to clinicaltrials.gov, you can search for COVID vaccine trials. And I can't tell you which ones are open now, but there are ones that are open. So if you're up for that, I really encourage people to do that. That's how we got to this point, and that's the only way we're going to move forward, is by having people volunteer for research studies. So that's an option for everyone, actually.
Right. Another question, I'll say these two together. One was about type 1 diabetes, when we have a sense of when that will open up. And I guess in general, what do you see as the next eligibility kind of categories that will come through?
Sure.
One person asked about, one person asked about whether you had to continue to get tested once you've had the vaccine, like if you test once a week or, more than that.
So what I would say is, so for the next group will be people who are immunocompromised, again, because that's already been rolled out in 1B, it's just being defined by New York State. I think the group after that will be those who are 18 to 64 with medical conditions, again, to be defined. And that will be, according to the CDC, would be the next group. And then the last group will be 18 to 64, with no medical conditions. As to when that will happen, it's a little bit hard for anyone to predict, especially because New York State went very quickly, was sort of at 75 and older for like a day, and then suddenly was at 65, and then suddenly is adding immunocompromised too, which is great, but they're not necessarily following like the kind of roll out one group, wait a long time, wait a long time. So it's really hard for, I don't think any of us can predict. I do think they're probably waiting just to kind of get some of these larger sites open, make sure there's supply, because if they open it up too wide, then there's a chance that the 75 and older and 65 and older then won't get vaccinated because there wouldn't be appointments. There are lots of really large city sites starting up. So they're actually going to open a really massive site at Citi Field. They just opened the Javits Center. So again, I think as soon as they sort of know there's enough supply and they have all of the staffing, they'll be opening up even more.
Great. Just looking, and you mentioned the testing. Can you speak to whether or not you need to continue to be tested after the fact?
Rob, do you wanna?
Yeah, I mean, I guess I would say it depends on why you're being tested. Certainly, if you feel ill and you think you might have COVID, you should be tested. You shouldn't assume that you're immune. If you're being tested routinely in for some other reason, I think that's sort of an individualized decision. It depends, I think, on what the reason is and the circumstances. But I wouldn't assume immunity in the sense that like you don't have to worry about it at all anymore. So I mean, I think, speaking from my own experience, it's a great relief to be vaccinated for me, but it's not like I feel invincible in that way anyway.
And you think that more relaxation and comfort will come with community immunity, correct? That's the idea.
Yeah.
It's the only way we're going to get out of mask wearing, social distancing, is to have enough people vaccinated.
Yeah. And on that topic, and by the way, I'm noticing that it's 8 and we said 7 to 8, but we are able to go another 5 or 7 minutes if that's okay with folks. And it seems worthwhile. And if you need to get off, of course, you're always welcome to leave a Zoom room easily. This is less of a medical question, so I don't know if you guys are the right ones to answer this, but someone asked about how you convince the skeptics, right, or the cynics to do the vaccination. What do you think works the best in terms of trying to get people to embrace? I mean, I think our SAJ community, thankfully, is quite embracing of the vaccine, but neighbors, friends, whomever, maybe less so.
I think I'll take the first stab of this one, if that's okay with you guys. So we definitely know a lot about vaccine hesitancy from pediatrics, and what I would say is what actually works really well is the tenets of motivational interviewing, which is to find out what people's concerns are and kind of unpack that and kind of go with their their concerns, and then ask them what they want more information about. We definitely know that if you start to talk to someone and start to throw at them all of these things, you should get vaccinated because XXXXX, you must be worried about this, let me tell you this, then people really close down and they can't hear you. And so the best thing to do is to really find out what is it that they want. And I'm actually looking, so my parents are here, I'm looking at my mother because she's a family therapist, and I think of her all the time when I talk about vaccine hesitancy, because she would say in couples therapy, if someone kind of comes at you like kind of like this, like someone else has nowhere else but to be except in opposition. And it's the similar thing with vaccine hesitancy. If you come with a lot of intensity to the conversation, people can't hear you and will just be, come back at you with a lot of intensity. So again, the best thing to do is sort of, don't say, are you vaccinated? But just say, do you have questions that I can answer for you? What we know about vaccine hesitancy is there are people who are just sort of anti-vax, never get vaccinated aside. But the vaccine hesitant people with conversations and answering their questions, people will often move towards getting vaccinated. And I think for this too, I think as more and more people get vaccinated, there have been millions of people now vaccinated across the US. People I think are feeling more comfortable with it, realizing that we have even much more information than we even had a month ago. And now people are getting their second doses. Some people kind of wanted to wait and see what happens. Now we've many, many thousands of people who have gotten their second doses and have been fine. And so I do think that will change over time. What I would say though, and I'm going to just looking at, Marina can chime in because this is one of her specialties, is there are communities, especially communities of color, who have a well-placed distrust of the medical system because there's been a very horrific history of experimentation. And I think if we don't, understand that and name that and understand that's not, so vaccine hesitancy isn't coming from, a place of not knowing what the vaccine, but really a distrust of the system that has been, pretty brutal over time. And so in knowing that, talking about having members of the community who have been vaccinated, kind of talking about their experiences, trusted members who know about the vaccine is really, really important. And again, to just to come with support and understanding and really love for those communities where this is it's been very, very hard for them. I don't know if Marina, again, this is one of Marina's specialties, and if you want to add anything.
Yeah, I think the critical piece is really this. I think twofold. One is that I think really understandably, community of color have had some very real ethical challenging situations around contraception, around syphilis testing. I mean, we know about Tuskegee, we know about a lot of pieces here. And we also know that a lot of times people just aren't given information, right? And so one of the reasons we're doing this tonight is because we want to make sure that in every community and place that we are, you have the information to make an informed decision. And I feel like even to the moment of vaccination, people were asking me great questions the other night, and I welcome them because you should ask questions. This is a time where we all are trying to band together to do what's right for ourselves and for our community, and you all should get all of that information. So I think that it is really, my hope is that with the new administration, there will be more clear messaging, that there'll be more clear information, and that with leadership that can give us trust and trust with facts, that more and more people will vaccinate. I saw a question earlier on about why, we're seeing a huge uptake with physicians. And there was a question about like CNAs and MAs, and a lot of those CNAs and MAs that we work with are from our local community in Washington Heights, and are saying like, we want to see you guys vaccinated first. We want to see sort of how it goes. And so I feel like it's my responsibility to say, this is how it went. Do you have any other questions? And so again, being able to open up a conversation. And I see that so many of you have gotten your appointments and gotten your vaccine, share that with whatever community you're in so that more and more people have that information.
Great. Thank you so much. So I think this is not as much about the vaccine, but I think while we're here and we have you here, of course, people are concerned about this new strain. I think Marcia Jacobson was asking, I think, for just a clarifying question, that did you say that people who are wearing masks are catching this new, more transmissible version of the virus? So like, what should we know? What can we do, if anything, at this moment?
Definitely not. If you're mask wearing, then you're, one of the wonderful sort of side effects, the silver lining of this season is that we're actually not seeing very much flu because people are wearing masks and social distancing and hand washing. So we know that that's going to be effective for even the variant viruses. And I'm going to let Rob take more on the variants because I think you know more about that.
No, I think you said it right. I mean, the virus does not become resistant to the mask. So masking, hand washing, social distancing are very effective regardless of the strain. And as far as we know, the vaccine is effective as well. But I think to some extent, I mean, the different strains, they're newsworthy and they're scientifically important, but I would maybe encourage folks not to get too worried about them, because the virus is going to do what it's going to do. We don't have any control over that. We have control over other things like what we've been talking about tonight. So, and there's so much unknown, and I think a lot is coming out now because we're looking for these things. A lot of these variants may have been circulating for a long time. I think it's the breaking news of the week, but I wouldn't get too worried about it.
Great.
It's enough to worry about.
There's enough to worry about right now.
Less after tomorrow.
Can you, right?
Hopefully.
Still plenty, unfortunately, but yeah, hope it will go down a little bit. Can someone put the website link for the Armory into the chat so that people have that? I know that SAJ members have been sharing links, sharing resources, talking about where they are getting their appointments and et cetera. And I know that's been really wonderful. And I just wanted to say that for to just be as clear and as the rabbi and not the doctor, but to be as clear as possible as I can from the pulpit in which I sit, and to say, I'm asking every member of SAJ to get vaccinated as quickly as possible. We want to be together again as a community in person. I'm actually gonna cry thinking about that. And you know, we need you, and we need you to stay. We've been so blessed and so lucky with people who've gotten COVID but recovered, minimal losses given everything, you know, given all the numbers, minimal losses. We're incredibly blessed. We want everyone to stay healthy, and I'm personally asking you to get the vaccine and to really help spread the message of this immunity, this community immunity, so that we can be a healthy city and that our kids can go back to school and we can pray together again and all the wonderful things that need to happen for us to be whole again. And so I just want to echo from my point of view. I can't wait to get mine. And I know that one of the things that we're doing in our community is we are every week for the next several weeks, we are having an aliyah every Shabbat dedicated to whoever got the vaccine. So this past week we had our first one, and we'll continue to do that every week. And of course, sometimes it's not in our control. We're trying to get the appointment and we can't, but we'll have that aliyah available for as much as we need to encourage and celebrate and honor. And honestly, also just to say, you know, the last thing, and then we'll close this part of the meeting, and then people who want to stay on for the service can do that. That really, this is an incredible miracle of science and the combination for me of humanity and the divine working together to create something in such a short amount of time that is going to move us forward in the right direction. As long as COVID has been, this could have been so much longer. And it's because of the unbelievable dedication of scientists and doctors like the three of you and so many others who are doing this work that we're going to, you know, be able to move forward as a community, as a country. So thank you guys so much. We love you. We're so grateful, so happy that you're part of our SAJ community, and so much love. So
Thank you.
so much.
Back to
Thank
you.
you. Mwah, mwah, mwah.